Okay, what's high blood pressure when it's idiopathic? What do we call it? Essential hypertension. Know that. Essential hypertension. What's a normal pacer for the heart? Sinoatrial node. Know that. If there's a small hole between the upper chambers of the heart, then it's a congenital anomaly. What do we call it? Atrial septal defect. Remember that. Angina pectoris, remember, angina pectoris can be relieved with nitroglycerin. Just know that. That's a new book. And we talked about it a little bit. If you listen to sounds within the body, what do we call that? We just talked about it. Auscultation. With the auscultation. What's a local abnormal widening of the artery? Look up John Ritter, by the way. Poor guy. It's an aneurysm. An aneurysm. Poor guy died there. He shouldn't have died. What do we call this thing? Sphygmomanometer. Right. What's the largest artery in the body? What are the largest veins in the body? What do we call it when the ventricles are contracting? Systole. When they're relaxed, diastole. You all make sure you look up cabbage. I call it a cabbage, but that's what they call them. Coronary artery bypass graft. Make sure you read about that. What happens when, what do you think somebody has if they wheeze? Asthma. It's real scary. I go to sometimes my kids' plays and I hear some little kid there. Kids having an asthma attack. Okay. Cyanosis. We covered that one today. Bluish discoloration because there's diminished oxygen. Caused by hypoxia, by the way. You know when an arrhythmia hits now, right? An arrhythmia. What's that space? What do we call that where you got nerve cells and it jumps from one nerve to the next? The synapse. Look up synapse. Remember to look up endarterectomy. I talked about a carotid endarterectomy. That's pretty common. But look up endarterectomy and look at the word pieces. Ectomy, remove endar within, artero, artery. They're removing plaque from the liver. You know what a small artery is, and you know what a small vein is, and you know what the smallest blood vessel is, I hope. If somebody has a mid-systolic click, what might they have? They're not the most valuable click. What is it? Mid-systolic click? MVP? Mitral valve prolapse. Mitral valve prolapse. You all know what a PDA is, right? Patent ductus arteriosus. We talked about that. We talked about last week, if a guy gets a checkup about my age, they're going to get some things done to check for prostate cancer. What is it? The DRE, which I'm not going to like, visual rectal exam, and the PSA. If somebody faints, what do we call it? A syncopal episode. Syncope. Make sure you look up syncope. We just talked about, I wanted you to know collapsed lung. Partial. What's a collapsed lung? A lot of times happens postoperatively. Before inspiratory atelectasis. Make sure you look up atelectasis. Make sure you look up epilepsy. That one's pretty easy. Breathing is only possible in an upright position. I talked about that several times. Orthopnea. Orthopnea. You all know what ischemia is, right? Ischemia, holding back the blood. You know what a nosebleed is. Epistaxis. What's that EKG kind of device they use to check for 24 hours? We call that Holter monitor. If they suspected someone had meningitis, what would they give them? Well, there's a whole bunch of people in the news right now worried about fungal meningitis, right? So, how would you diagnose meningitis? What test would you do? A lumbar puncture, spinal tap. What's a hernia of the meninges in the spinal cord? Remember I showed you last week that poor child had a myelomeningocele. And pull that apart. Seal means hernia, myelo means spinal cord, meningo means meninges. So look at that poor child that had that. You all know what COPD stands for. You know, it can be associated with emphysema, chronic bronchitis. What's the disease where people wander and they get the amyloid plaques? Reagan had it. You read about Alzheimer's disease. What was the demyelinating disease we talked about last week? Multiple sclerosis. Read about multiple sclerosis. I gave you this one today, an inflammation of a vein with a clot. Itis, thrombophlebitis. A lot of guys in here are going to get benign prosthetic hyperplasia, BPH, and what is a procedure that is commonly performed for that? We talked about last week. TURP, T-U-R-P. Make sure you know what a T-U-R-P is. A lot of guys in this room are going to figure it out soon enough. Hey, if somebody has cryptorchism, what would the surgical procedure be to pull the testicles down and fixate them? Orchiopexy. Make sure you look at orchiopexy. Where does sperm learn where to swim? Mature and learn where to swim. Had that last week. Epididymis. Epididymis. You all know what the windpipe is called? You all know what the throat is called? You all know what the sacs of the lung are called? Trachea, pharynx, alveoli. You all know why I call the heart a double pump today. We talked about in the nervous system of somebody, if I went to the hospital and my mouth was sagging here, and I was paralyzed on this side of my body, where do you suspect I had my stroke? On the opposite side, because you know the nerve tracks cross over the medulla oblongata, which is part of your brainstem. I had this one today, and I was pressing this one. What is not a reason to put in a pacemaker? Please, no. You know that one. You know that. If you had a pleural effusion, which is fluid, too much fluid, how might you treat that? With a thoracentesis. If you were suturing a nerve, what's the word for suture? The suffix? Graphic, uroraphy. Surgical repair of a valve. We talked about that today. Surgical repair is plasty, and the valve is valvuloplasty. What's the inability of the heart to pump the blood that the body needs? About that today. The heart can't pump the blood that the body needs. We call it what? CHF, congestive heart failure. What's an incision into the chest? What are substances like acetylcholine, dopamine, serotonin? What do we call those? Neurotransmitters. I talked about digoxin today. Digoxin helps the heart beat more forcefully. What's burning pain? Burning pain. So pain is what? Algia, causalgia. What's the disease where there's a lack of dopamine? And we talked about Michael J. Fox has it. Parkinson's disease. Read about that. What's water on the brain? Hydrocephalus. Hydrocephalus. That's it. You're in good shape. You did pretty good, actually. Big chapter.